Many patients want control over end-of-life care decisions, or just decisions for when they get very sick. And it can be a blessing for loved ones who otherwise have to make tough decisions in a tense environment. But traditional advanced directives are often ignored and can even backfire. Can technology change that equation for the better? I want to take the chance to thank my family for making a big effort to get together for Thanksgiving, and especially those who are coming from thousands of miles away. It's going to be great to see everyone, and especially together in person to say happy birthday to my dad. This month, November, is all about gratitude, and along with my family, there's someone else we don't thank enough, and that's ourselves. So it's sometimes hard to remind ourselves that we're trying to make the best sense of everything, and in this crazy world, that isn't easy. So here's a reminder to send some thanks to the people in your life, including yourself. BetterHelp offers entirely online therapy that's designed to be convenient, flexible, and tailored to fit your schedule. Just fill out a brief questionnaire to get matched with a licensed therapist and switch therapists at any time for no additional charge. It's helpful for learning positive coping skills and how to set boundaries. It empowers you to be the best version of yourself. So whether you're dealing with stress, anxiety, or seeking personal growth, BetterHelp connects you with licensed therapists who can support you on your mental health journey. Let the gratitude flow with BetterHelp. Visit BetterHelp.com/CareTalk to get 10% off your first month. That's BetterHelp, HELP.com/CareTalk. Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Dr. Ferdinando Mirarchi, CEO of MIDEO. The company helps patients record advanced care directive plans on video. Welcome, Dr. Mirarchi.
Hi, thank you for having me.
Well, what is an advanced directive, and what is it supposed to accomplish anyway?
So advanced directives themselves, and this is going to sound like a mundane kind of answer. It's basically a paper-based document. It's a legal document, and it's supposed to give you, a patient, a voice in your care to either accept or decline life-saving condition or life-saving treatments when you are in a terminal condition or persistent vegetative state.
Well, that is a simple answer, but also one that I think calls into question about, the theory versus the practice. And I wonder, what are the limitations of these traditional paper-based directives?
So great question. So limitations wise, one, they're paper, right? We're in the 21st century and we're still dealing with paper-based documents and so on. Two is portability. So these are 8.5 by 11 page documents. There's more than one page to them and so on, and people would have to carry them wherever they go. So if you were going to bring it with you, and people don't typically carry them, right, because it's a file-based type of paper. But if you're going to go to a hospital, you have to think to bring that paper with you to the hospital or to the doctor. So those are the two most, antiquated as far as limitations. The other limitation, which becomes a big clinical limitation to them, is that they're interpretable, meaning someone has to read it and make a decision. And that decision, I often just, and I don't nonchalantly say this, is often a guess. And it's often a guess by a medical provider who doesn't really know you as far as what they're supposed to do to save your life or to allow you to die naturally. That becomes the biggest clinical limitation of those documents in and of itself.
So, good idea to put one of these documents in place to think through what you might want if you were in search of circumstance, and to communicate it to your family and then to formalize it. But in practice, it doesn't work out necessarily so well. So that's where MIDEO comes in. And I wonder, how is MIDEO different from the traditional approaches? What are some of the benefits of what you do?
Great question. So first and foremost, when living wills came about, they were never really evidence-based, right? It was a good idea by somebody. It was a good idea by someone, hopefully, to have a person at that time when they were created decline life-saving care and treatment, right? They then subsequently morphed. You can accept or decline life-saving treatment with them now. So that in and of itself became an issue, right? So the other issues that come with these types of documents and directives is, again, we come back to that whole point of whether or not people understand them correctly and the limitations behind them and so on. So what we did with MIDEO to make this all a better process is to really bring an evidence base to it. So we have research. We have patient safety research called the triad research that has spanned decades of times now, that we took the same issues related to the documents, figured out fixes to them, and actually made this a safer process for patients. Kind of like a stop guard measure. Essentially, before you enact, you get to now look at a video of a patient actually explaining to you what they want in terms that you can understand as a physician.
All makes good sense. And I went through this process with you. I'll show the card that I got. It's complete with QR code, my picture. It's got witnesses signed and my own signature, and a link to that paper document that the healthcare system cherishes so much in case they want to get that and download it.
They do want paper, don't they?
Yeah, indeed. Indeed. Well, good. Well, that's it for the latest HealthBiz Brief. If you like what you hear, check out my HealthBiz podcast for a full-length interview with Dr. Mirarchi about his life and career. Dr. Ferdinando Mirarchi, CEO of MIDEO, thanks for joining me today on HealthBiz Briefs.
Thank you. Thank you for having me.